When we're thinking about trying to reach people's true potential, that normally isn't done alone. It's normally done with others and through others and by supporting others. True potential, not just of the individual, but of the collective, I think is a really important consideration.
Deirdre O'Shea is a Professor of Work and Organisational Psychology at the Chemie Business School, University of Limerick, and a Fellow of the Psychological Society of Ireland. She is a General Secretary and Executive Committee member of the European Association of Work and Organisational Psychology. Her extensive and award-winning research explores a broad range of topics, focusing on applying psychological principles to understand work motivation, self-regulation, and performance behaviours for individuals, teams and society. Join us as we explore these concepts in more detail and how they underpin the human side of change as we seek to improve quality and patient safety. I'm Juanita, Guidera, a Programme Manager with the National Quality and Patient Safety, and it's my pleasure to welcome Deirdre and you, our listeners, to the 25th episode of the Walk and Talk Improvement podcast. Deirdre, thank you very much for joining us today.
You're more than welcome, Juanita. Delighted to be here.
We'll start, I suppose, in quality and patient safety. We often rely on people's desire to make a difference to improve quality, that intrinsic motivation that we all have. As we get started, could you tell us what is motivation to you and how does it impact important work behaviours like being proactive or taking initiative?
Work motivation is one of the things that I am very motivated to talk about. Not to start with a pun, but I always love talking about work motivation. And I say to my classes, normally it's one of my most fun modules when I have to teach this. Broadly speaking, because even though we all know when we're motivated and we all know when we're not motivated, it's actually a bit more of a complicated story when we start looking at what really is motivation. And you talked there about the idea of intrinsic motivation, and that's a distinction we make in terms of the type of motivation that people experience. And we make a distinction between the type of motivation people experience and how they subsequently motivate themselves, which is normally what we more think of as whether I'm motivated or I'm not motivated. And intrinsic motivation really happens when we enjoy something. So, if any of the listeners have kids at home, they probably see them playing. They don't have to motivate kids to play, right? I mean, we just, as children, we all played, we love it. So we're intrinsically motivated by play. And that means basically we enjoy doing it. We don't have to increase our motivation to play. Sometimes we do have to increase our motivation to work. There are days when, we're not in the humour, we don't feel like it, we had a hard week, we're tired, that sort of thing. So when we think about this interaction then between the type of motivation we experience and the amount we have to motivate ourselves, when we're intrinsically motivated, we don't actually need to increase our motivation. We are motivated, we enjoy doing what we're doing. So that's one type of motivation in a broader categorization or broader typology of several different types of motivation that are beneficial or enjoyable. Intrinsic motivation being one, but very importantly for the question you asked me, which is when people want to make a difference or when they want to improve quality, is that is a value. So if we can work in line with our values, in line with who we see ourselves as individuals, our work identity, we find that very rewarding and we find that very satisfying. We find it very motivating, if you want to think of it like that. And we can contrast that with other forms of motivation where we feel under pressure to do something, either from others or from ourselves. So when we feel pressure to get work done by the end of the day, or when we have tight deadlines, for example, we don't tend to experience that in the same way as our children do when they're playing, right? So that is more effortful and it's more taxing on us as individuals. So if we want to really think about how do we harness people's motivation to make a difference, we need to harness their motivation around what values they have as individuals, how they can express that in the workplace. And when we use those collective forms of motivation, including intrinsic motivation as well, it's a term we call autonomously motivated, then people are more likely to be proactive and they're more likely to take initiative as well.
Okay. And have you any suggestions for helping encourage people to tap into that motivation?
Yeah, so we can think about how we design workplace and workplaces, how we design work. And that's a lot of what my profession ends up doing a lot of the time, is thinking what makes work an enjoyable experience for people, or at least how does work not harm people? And that really comes down to different types of work design components. There's models of work design that are around since the 70s, but one of the most recent ones is they used to have an acronym for SMART goals. Now we have an acronym called SMART work. So it stands for stimulating, mastery, agency, relational, and tolerable demands. So if we think of the type of work that, many people would do in the type of organization that the HSE is, there's a lot of task variety, there's a lot of day-to-day changes, there's probably a lot of problem solving that needs to go on. So we have the stimulating component. We have a lot of stuff around having clarity around who does what and what are roles and so on. But hazarding a guess here, but there's probably a lot of demands in the jobs as well. And demands in and of themselves are not a bad thing. Actually, we're bored if we don't have enough to do in the workplace, but they need to be tolerable. So we need to think about how do we manage that. And some of that is workforce planning, some of that is organizational structures, some of that is the work itself and how we interlink jobs, or something we call job design. But the relational component then, of course, is very important as well, so that people feel like they are supported, that they have colleagues and supervisors and so on that they can rely on, that they can go to, if you need a helping hand, you need to ask something about somebody. Another really important aspect is that we feel what we do has benefit for others. So there's a sense of purpose in our jobs. And of course, if you're literally involved in saving lives every day, there should be a lot of meaning and purpose in work.
Yeah, no, absolutely. I think that makes a lot of sense. It's interesting, a few years ago, the National Staff Engagement Forum, as it was, developed a definition for staff engagement. And the final piece of that was that I know that what I do and say matters and makes a difference. You've all of the theory behind this stuff, but they're the words of the staff working in the system, and they talked about how important that was for them. I'm struck by how those things can potentially change over time. So the clarity piece, there's a lot of organisational change happening at the moment, and people may not necessarily have the same clarity in some areas of their work as others. Are there things that we can do when that happens, when there is maybe a period of reform or there is a degree of uncertainty, to support people?
Yeah. I think that's a question that lots of different organisations across the globe are asking themselves at the moment. Regardless of what industry or what organisation you are, it seems that there's a constant change. There's so many different things. I won't even mention AI, but there's so many different things happening that most organisations are experiencing this idea that we can't keep up with the pace of change and we still have to respond, both as organisations and as individuals. So one of the things that can help with that is encouraging and creating space for people to be proactive. So to be able to take initiative, that's a very, very important aspect of it, but also flexibility and adaptivity. And interestingly, the same people, actually Sharon Parker and her group in Curtin University in Australia, who developed that SMART model of work design, also developed a model of work performance, which includes not just can we do our jobs, but will we be flexible, be adaptable, and will we be proactive? And that's actually a core to how we conceptualize the way in which we should be thinking about performance in workplace settings these days.
Oh, that's really interesting. One of the areas that you research and you've looked at a lot is that whole area of self-regulation. Could you tell us what is that?
Sure. So I talked about the difference between what motivates us, or the type of motivation that we have, and how we motivate ourselves, or how we self-manage ourselves. Self-regulation is tapping into more how we self-manage ourselves. So not management that comes from the organization, not management that comes from the structures or the design of work, but how we self-manage ourselves. We normally think about that of, can we get through our to-do list every day? That's an example of self-regulation. Or can I manage my day enough to the extent that I can plan what I need to do? I can schedule my tasks. I can monitor my progress towards those tasks. And I can hopefully at the end of the day shut down my computer or leave the workplace with all my tasks done. It doesn't normally happen like that, but that's the idea. But self-regulation is really about the ability to self-manage ourselves. So that's about self-managing our behaviours, so what we do at work every day, and also our planning abilities, which we would refer to more as a cognitive component. But we also manage our emotions a lot on a day-to-day basis, particularly if somebody is patient-facing or customer-facing or client-facing. There's a lot of emotional regulation that has to happen, whether that's showing more positive emotions or not showing more maybe negative emotions that we feel we shouldn't be having.
Yeah.
And we can also manage our motivation, actually, so we can increase the motivation or change the motivation that we have for something as well. And I've been interested in self-regulation for close on 20 years now at this stage. And one of the reasons that I'm really interested in it is because if you stand back and look at psychology as a profession, there are two main things that have been shown to be important across every single life domain. So to increase performance, for example, in loads of different areas. One of them is intelligence. So the more complex a task is, obviously, the more intelligence we have. Hard to change intelligence. Not impossible, but hard. And the other one is self-regulation. So how we self-manage ourselves. And one of the reasons I'm so fascinated with self-regulation is because it is something that can change. It is a skill that we can improve. And it is something that if we can improve or develop the range of self-regulation skills and strategies that we have, the better we are able to manage ourselves, the better we're able to manage our relationships, the better we perform in the workplace. Broadly speaking, it says it contributes to optimal functioning in life. Why wouldn't I be interested in it as a psychologist?
Absolutely. And even from a personal perspective, I think the question there is in how do you do that? Say, well, actually, my intelligence is as it is, I can learn and I can do things, but how do I improve or increase my capacity to self-regulate? Where do you start?
Yeah, so self-regulation is a process, actually, as well as a set of strategies and a set of skills. There's various strategies we can use to manage our emotions, various strategies we can use to plan our day and so on. We can learn those strategies, but the other question is, how do we know when to use them? So the first thing we normally do when we're developing, for example, interventions to improve self-regulation is we increase self-awareness. So we have to be aware of what we are doing and what we're not doing and what we could be doing before we can change those things. So self-awareness is a really, really important first step in developing self-regulation skills. Sometimes that can come from just reflecting on ourselves. Sometimes it can be by talking to others. We have been involved in developing self-regulation skills for people who are hybrid working, for example. So after we build that self-awareness, we can start training people to think about, when should I use these specific strategies? Do I need to focus on managing my emotions? Is it more about focusing on my goals and how I implement them and so on? And we guide people through a self-regulation process, which is looking at, okay, am I aware of it? Then what is in the environment that I might need to regulate or that I can't regulate, for example? You might not be able to say, as a medical professional, I'm not going to see any patients who are going to upset me. That's probably not a realistic one. But when I do, how am I going to manage it? What am I going to do? And then learn strategies and start understanding yourself in terms of which strategies are more effective for the individual, which strategies are effective in particular environments. And that's where that adaptive component comes in. The most skilled people in self-regulation are those who have a range of strategies that they can use, and they can choose one, not always consciously, but sometimes it becomes such a well-learned skill that you don't have to consciously think about it, but that you choose a strategy for the particular situation that works for you as well.
Okay. You talked about that self-awareness piece and our own thoughts on it, but also the people around us. How important are the views of the people around us when it comes to self-awareness? Like, is it enough to reflect myself on it? Do I actually need to be talking to people around me and say, well, how do I come across? How do I manage when I'm under pressure to get that third party view?
Yeah, it's a bit of both. It really is a bit of both. We probably know ourselves pretty well if we sit down and think about it, but there's probably other things that we don't realize in terms of how things come across to others. What's going on in my head may not be what somebody else perceives. So there's always a difference between what someone's behavior is and what is the perception or the attribution of their behavior. So regardless of, somebody might be thinking they're doing the kindest thing in the world and somebody else just perceives it entirely differently, and we can't predict that. So it is definitely a bit of both.
Okay, that's interesting. We know from the evidence, self-regulation, it's an important factor in speaking up. And in healthcare, we know that that's an important element of learning from patient safety incidents and creating a just culture. How is our voice impacted by self-regulation?
Well, we make a choice to speak up or not, always. And so from that perspective, voice is considered a behavior that we can regulate, if we put it in that context. If we think of what type of behavior voice is seen as, when I do research on it, it's considered a proactive behavior. So it is something that is, I'm taking initiative, I'm being proactive to speak up. And it's normally considered a constructive behavior. The idea being somebody has to care enough to speak up to try to change something, even if that can lead to difficult conversations or if it can lead to understanding things that we need to change. It is something where somebody is trying to make a difference and trying to improve things normally for the better, whether that's for their own jobs, the organisation as a whole, or something between those two broad levels. It is an example, though, of what the behaviour is, so the speaking up or the voicing, and the perception of that behaviour can be different. So there's really interesting research from a few years ago where they looked at how speaking up is perceived. And actually, it's perceived differently depending on, for example, the emotions are expressed with it. So when people speak up, but they show more negative emotions, it's perceived not as positively or not as constructively. Or when, for example, a manager perceives that somebody is speaking up, but not from a pro-social perspective. So not, we call that pro-social motives, but from a place where they're not trying to change things for the better, then obviously it's not perceived as well. So it's not so much about what's being said, but also how it's being said and how we're managing the emotions that we have about it as well. Yeah.
Okay, so that the self-regulation piece taps in there as well in terms of managing your emotions. Touching on that, are there factors that can silence our voice? You talked about often when someone speaks up, it's coming from a place where you want to change things. And I've come across scenarios where people really do want to change things, but there can be other factors at play that can inhibit. But is there anything in the research around factors that can silence our voice and how you could address that?
Yeah, and that is one of the really interesting things about the silence and voice concepts when you start putting them together, is that even though they're opposites in terms of behaviours, they're not opposites in terms of the motives that stand behind them. So we normally look at 3 different reasons why people either speak up or remain silent. One is for defensive reasons. So I feel like there's some threat to me or to another person if I speak up, or if I might stay silent. So I might speak up to defend somebody. I also might stay silent to defend myself or somebody else. The second one is I couldn't be bothered, or I don't think there's going to be any impact if I do it. So if I speak up, will it change anything?
Yes.
If it won't change anything, why would I bother? So that's more like an acquiescent motive for us either speaking up or remaining silent, or I just agree to get out of the meeting and get on with the day because I've been sitting here for an hour and a half or something like that. There's an acquiescent voice as well. And the third one then is the more proactive or pro-social one, is that I speak up or I remain silent for pro-social reasons. So to benefit another, to help somebody else in those situations. And it's really the attributions of those motives then that can determine whether voice is perceived positively or negatively. We can think about why people might feel defensive, why they might feel it's not worth it. And that gets back to things like voice mechanisms, and is there a forum for communicating changes or things that people think should be improved? Is there a feedback mechanism for, yes, we've listened and these are the actions that we've taken, or yes, we've listened and even though we see the benefit, we weren't able to change X, Y, and Z?
There's a lot in that. You touched on defensive there. One of the things that's coming to mind is that whole area of self-regulation and incivility in the workplace. And that's another area of your research. We know, I suppose, within a healthcare context, that it is a challenge and it does impact patient safety. There was a systematic review a few years ago. It looked at the evidence on the impact of incivility, and it found that it impacts our capacity to do our jobs, and it influences everything from our medical, physical, cognitive skills to teamwork, professional communication, and ultimately that patient safety piece. We did a QPS Talk Time with Dr. Chris Turner. He's one of our huge advocates for civility in the workplace, and he cites a statistic that rudeness in the workplace has been linked to a 50% drop in our willingness to help a colleague. So if we're trying to encourage partnership or engagement in quality and patient safety, this is a really important consideration. We hear that word a lot. What does it actually mean?
So first of all, incivility is different from bullying. It's different from more severe, what we might call deviant behaviours in the workplace. It's low-grade rude behaviours. And the interesting thing about it and the important thing about it is that there's ambiguity in terms of the intent. So we're not sure whether somebody meant to be rude to us, or we're not sure if they meant to be short to us. We're not sure if they meant to exclude us from that meeting that we probably should have been at. And so there's a big difference between somebody who deliberately excludes you and somebody who just accidentally, because they were busy, left you out of an invite. Very big difference. And because of that, then we're not sure how to react, and we're not sure what action to take. And so that means it can go around in our heads a little bit. It can be something that we have to, did they mean to do that? Did they not mean to do that? And so we can ruminate on it a little bit because we're not sure how to interpret it and we're not sure how to react. If we think, well, actually that person is just, they're not very nice, they're always like this, then of course, why would we be nice in reciprocation? We try to have balance in our relationships, broadly speaking. And so if somebody does something nice for us, not to be transactional about it, but if somebody is kind to us, we tend to want to reciprocate that kindness, or we tend to want to pay back that favour. Whereas if somebody is rude to us, we may also respond in kind. And that's why we talk about an incivility spiral. So if I think that somebody's being rude to me and I'm a bit short back to them, and then they perceive that, so we spiral downwards. But people can also, even if they don't react, they can also just pull back a little bit from those relationships or protect themselves from those relationships as they feel somebody is rude or constantly negative, those sort of things. And for that reason, that's why, for example, if there's a lot of perceived incivility in an environment, people will be less willing to help others. They'll be less willing to help a colleague if they need to. And of course, we all operate in social organisations. Very few of us can say we do our work and we don't need anybody else at all. And particularly in healthcare settings where it's a lot of interdisciplinary, multidisciplinary teams, lots of different professions needing to interact with each other, very complex organisational structures when you're trying to deal with all the different things that go on. We need that willingness to help others, and we need that willingness to do a favour for somebody, even though it might not technically be part of the job description. And so when we have high levels of incivility, we lose that goodwill.
Yeah. And the distraction piece that you talked about, that definitely came across in the research in terms of my capacity, that they looked at medication errors. And if somebody had witnessed incivility, they were 50% less likely to pick up a medication error. So it's both elements of it are important when we're looking at that whole area of patient safety. I'm wondering our own responsibility for regulating our own behaviours. We always say you're responsible for managing your own emotions, you're responsible in your own space, but can we influence the behaviour of others? When we think of things like incivility, can we influence that behaviour?
Yeah, absolutely. So Michael Leiter was one of the people who first started researching incivility actually in healthcare settings and developed a whole intervention program around changing culture and really simple things about also identifying what are the behaviors that are important for us in the workplace. How are we going to treat each other and developing an agreement around that, and then having checks and balances with each other actually about that could have been perceived a little bit differently. I'm not sure you intended it like that. Or even simple things about going back to the values piece, putting those behaviours up on notice boards, reminding people of them, but also being a bit forgiving of others, not judging people immediately, saying, well, actually, I know that person's under a lot of pressure at the moment. All right, they could have been a bit nicer in terms of how they said that. But look, they've been up for 30 hours or, whatever. We'll give them a bit of leeway. So it's that not just expecting people to behave perfectly all the time. None of us can do that. But also knowing our teams and knowing who we work with so that we know if it's not typical behaviour for them.
That's it. The relationship being fundamental to it, and knowing that you've put time into building a relationship, it's much easier to sort of say, gosh, that's not the way they normally operate. That's not them. It is easier to move beyond something or have that conversation with someone and say, listen, what's going on? Is everything okay?
Exactly.
Yeah, that's interesting. You talked about a key element of influencing the behaviour of others around creating trust.
Mm-hmm.
Trust being fundamental to our relationships. When teams are working closely together, we often see things like groupthink beginning to emerge.
Mm-hmm.
In particular, when we're working with the same people for a long time and where teams might reach decisions without an actual discussion about it because nobody wants to upset the status quo or challenge someone. How does groupthink impact trust and ultimately that sense of psychological safety in teams?
Mm-hmm. So groupthink is basically it's a social or it's a group phenomenon that occurs for a couple of reasons. First of all, people are very like-minded, which they often are in organizations or in the same professions. We get trained the same way. We start thinking the same way. And so then we start thinking that, well, our decisions are correct because we all have the same opinion, which they might be, but not always. And the other time it happens is when decisions have to be made very quickly or under a lot of pressure. Then we need to get consensus very quickly. We need to take action very quickly. And that's when we can maybe not think as much as, what we might need to. So trust is defined as a willingness to be vulnerable to others. So will I put my trust in them, if you think of it like that? Interestingly, when we trust very highly in our team, we're probably more likely to engage in groupthink because we trust them and maybe we don't question as much as we might need to. And also in issues of low trust, it can also be an issue as well. So some of the things we can do about groupthink specifically is around always having one person who is, you might think of them as the dissenting voice or the critical voice or something like that. And they're given permission to do that. Not everybody doesn't get cranky with them because they're always the person who has the other opinion, but they're put in that position in for a particular period of time or in particular meetings or something like that.
Yeah.
We can also think about how we build trust in organizations and how we build psychological safety. And of course, there's over nearly 25 research on psychological safety, which is a related concept to trust, but there are differences between it. Psychological safety was a concept developed by Amy Edmondson in the early 2000s, actually about speaking up in surgical teams. So did people feel safe enough to speak up if they thought there was going to be errors in surgical teams? Of course, in that situation, you have to trust that there's not going to be negative consequences because you are making yourself vulnerable by speaking up about an error or something like that. So there has to be trust in the team, in the professionals who are in it, in the system, that there won't be negative consequences. Ways we can do that are by taking time for reflection before, after different procedures or when change is happening to say, how could this go wrong? Or what are all the mistakes we might make in doing this and how we can prevent them? So there's a well-validated training method called error management training, which actually encourages people to make mistakes in training, which shows that they're less likely to make mistakes or less likely to make errors afterwards. And of course, it's a lower risk environment if you try to make all the mistakes possible in a training session. Hopefully you won't make them later on or you'll spot it if something's going to happen. So that's one way we can avoid some of the groupthink, but also encourage people to speak up in a psychologically safe way to avoid errors.
Okay, yeah. There's a few really interesting pieces there. I was struck when you were talking about the critical hat. I had a colleague, a manager of mine over the years. He always said you should always have a devil's advocate. The devil's advocate is the most valued member of the team. But to Bono, we would have come across the 6 thinking hats where you can rotate that role so that the one person, it doesn't always fit with one person and they don't end up with the name of, oh my gosh, here she comes again.
Exactly.
I really like that. And working backwards, we've used a few methods. So some of our liberating structures look at reverse engineering a problem.
Mm-hmm.
So looking at all of the challenges, looking at all of the issues that can present, and it is a really good way. We don't sometimes see the negative, or we're not really willing to talk about the dark side unless we're given permission.
Exactly.
I think there's something in that. With all of these sort of topics that we're touching on, incivility, silence, the motivation, their impact on turnover, I'm curious about that because a recent study in the University of Surrey, they found that more than 4,000 people could be dying per year in the NHS because of high turnover rates of doctors and nurses in hospital. That's really, really significant, linking it purely to turnover. Do you think those things impact retention and turnover within health services or work in general?
Yeah, so one of the reasons why turnover can be associated with poor patient outcomes is because when you have a highly skilled, highly trained workforce and you lose them, you can't just replace them very easily, because even if you are trained in the profession, you might not be trained in the procedures of a particular hospital or a particular location. So there's a lot of things to learn and probably a lot of tacit knowledge that gets lost when people leave. So we try to avoid it as much as possible for obvious reasons around if it is leading to extra deaths per year. That's a huge negative implication of it, but also because the time and effort that it takes to retrain people, to onboard people, to hire people in the first place is hugely costly as well from purely a HR perspective, if you want to look at it like that too.
Okay.
So how do we prevent that? Well, there's loads of different ways. Of course, we can go back to the design of work that we talked about and designing jobs so that they are sustainable. People are less likely to get burnt out. We know that, again, coming back to those tolerable demands components, that can lead to the more demands that are on us, the more errors we can make. If we make more errors, we have more negative consequences and so on in terms of patient outcomes. So thinking about those sort of things, but we can also think about then the more social component around it. Again, do we trust the people that we work with? Do we know we can rely on them? So there's 3 different aspects of trustworthiness that we look at. Do I feel they're competent? Can I trust in their competence? Can I trust in their integrity or their honesty? And can I trust their benevolence? So will they work in my best interests, which can be sometimes a good thing or not so good thing. They obviously need to have the integrity in the first instance.
Yeah.
So when we think about that, then how do we create this sense of trust and how do we create this sense of safety? We've talked about a few of the ideas, but we can also think, if we go back to our emotion regulation, we can think about, we often try to help others to regulate and their emotions, or even to regulate the emotions of others. So not specifically related to turnover, but we are looking at it in turnover at the moment. We've looked at a concept called interpersonal emotion regulation, and that is how I manage the emotions of others. And we do this all the time, right? We say, oh, just don't worry, it's not so bad, making a mountain out of a molehill or whatever the case may be. Now, interestingly, we can distinguish between 2 broad ways of managing other people's emotions. One is that we try to improve the emotions that they're feeling, so emotion improvement strategies, or we can try and make them feel worse. You might be saying, well, why would I want to make them feel worse? But there are times when we might need to make somebody realize that actually that type of behavior is not appropriate, so they feel worse about it. So we did a study on this actually during COVID. During the COVID pandemic, of course, one of the really important things was that we try to influence the public. So everybody in the country, everybody across the globe essentially needed to comply with these behaviors. None of us wanted to stay at home. None of us wanted to stay 2 meters away from others. Nobody wanted to be restricted to 2K or 5K and so on. So why did we do it?
Yes.
Maybe because we saw the social value in it. We saw the fact that this was saving lives and so on. And so if you think about it, making people feel worse in that situation, so increasing their fear, should have increased their likelihood to comply with those behaviors. Not necessarily the best way of doing it, because it made us even more worried and anxious than we were already. Actually, what we found is we studied some of the Taoiseach speeches, and we asked people directly after the speeches, would they comply with behaviours? But we also asked them their perception of the types of words and language and phrases that we use. We all remember we're in this together, we're all in this together. So that's an example of an emotion improving interpersonal strategy. And what we found was that the more of those types of improving efforts that the Taoiseach made in the speeches, the more we trusted in our leaders, our national leaders, the less negative emotions we actually felt. We all remember the negative emotions and fear we felt. And the more likely we were to engage in behaviours we needed to do as a public. In the UK, we did a similar study, obviously different leader at the time, different prime minister, and found the same type of relationships. We've done that study also with managers, and we find similar impact in terms of people will continue with their goals or whether they'll have turnover intentions, actually, which is a very long-winded way of me getting back to your question about turnover intentions. And so we see similar patterns. When managers or leaders engage in trying to improve people's emotions or how they feel about their jobs, how they feel about a particular situation, the more trust we have in them, the lower negative emotions we feel, and the more likely we are to stay in our organisations or to engage in behaviours that we need them to engage in.
So I'm curious then, one of the things that we talk about within quality improvement is that whole area of compliance and monitoring. So from what you're saying, from a management perspective, we're probably more likely to get good engagement if we're focusing on the positive side in terms of we're doing this for the people in our communities and our families and our friends. And those are the people that we're meeting and we're working for, versus we have a report due on Friday. Would I be correct in saying that?
Yeah, I think so. You're giving me ideas for research studies now, Juanita, but it makes sense, absolutely. That is completely logical. Yeah.
Okay, so words matter. It's interesting, a colleague of ours did a study a few years ago, and it's a small thing, but they talked about near misses and they changed the language to a good catch. It's a little bit different, but again, it speaks to that whole area of language and how language matters, because they increased their reporting significantly when they talked about good catches versus the near misses. There's something in that for people to ponder on maybe and see what they come up with.
Exactly.
Some of, what you've touched on relates to our behaviours, how they impact things like that engagement and improvement. And I'm fascinated by your upcoming research. It's a new project funded by the EU called SHIELD. Could you tell us a little bit about it?
Yeah, sure. So a lot of what I've spent the last 15 years doing is trying to design interventions to help people to change either their self-regulation or their behaviours and so on. And so SHIELD is a new project funded by Horizon Europe, which actually has nothing to do with the workplace. So I'll have to explain a little bit why there's a work and organisational psychologist involved in it. But it stands for Strategic Health Initiatives for Effective Disease Prevention. So, as I'm sure most of your listeners will know probably better than I will, so non-communicable diseases, of which diabetes and cardiovascular heart disease are two examples, are one of the strategic priorities from a health perspective that the EU wants to target. And so in this project, what we are doing is across a multidisciplinary team across Europe, which involves 3 different hospitals, multiple consultants. We have several different technology partners, and we have the psychologists in Limerick who are coming together to help to develop a multi-level platform to try to help people to better manage 2 specific diseases, of which the ones we focus on are diabetes and cardiovascular heart disease. So what will this do? Well, it's based on an approach of personalised medicine. So first of all, it's going to identify the major risk factors using lots of large data models to identify what are the risk factors around these. And then we're going to intervene to try to help people depending on their level of risk. So whether it's high, medium or low. So whether they already have the disease and are trying to manage it with a consultant, or whether they're a member of the general public just at risk of developing it. And that's where we come in, because we're going to develop an app. Well, personally, I'm not going to develop an app, but the team are going to develop an app. I don't have those skills. I'm and my team in Limerick are going to develop the behavioural interventions around those. So one thing is, what are we going to be asking them to do? There's a lot of course, very clear guidelines. And the question is also, why don't people adhere to the guidelines? That goes back to self-regulation, right? How can we manage this? So we're going to develop behavioural change techniques to encourage people to engage with the different types of things that can be doing, whether that's making sure they take their medication or whether it's trying to increase their exercise in particular to particular targets, or it's changing their diet in some way. Simple examples, but how many times do we start our New Year's resolution every year and you're like, right, going to eat healthy from January. The tub of roses is going in the bin. That's it. Once it's gone, it's gone. And then come the middle of January, we're back out buying chocolate or whatever. So easier said than done. So what we're going to do is use all those things like we've talked about around the motivation, the science behind it, the behaviour change techniques to hopefully help people to maintain those sustained behaviour changes that we want them to do. And it will react dynamically. So this is where all the artificial intelligence experts will come in. The app is going to dynamically change so that the suggestions are personalised to each individual. That's been shown to obviously make a difference in terms of getting people to adhere to behaviour change. So very excited. It's a really exciting project. It's going to go on for the next 4 years. And hopefully it'll be very impactful in terms of creating a platform that we know will work for these 2 diseases that can then be broadened out to other diseases and also other behaviour change, whether that's around disease prevention or it's around engagement in the workplace or whatever the case may be.
Okay. And can I ask you, just in terms of those motivators, and we look at, behaviour change, are they similar no matter what you're working on?
Within broad categories, I would say yes. We have to think about the context that people are residing in. So for me, most of the time, I'm looking at the workplace. And I would call that a context that has a lot of achievement focus. There is a performance goal. We normally have to perform in some way. Of course, we want to keep people well. I normally say to my students, it's not that dissimilar from an educational setting, which is also an achievement-oriented environment. You have to perform in particular ways. Within those broad categories, if you think about what is the context, the same principles that motivate somebody in the workplace should motivate somebody in sport, should motivate somebody to adhere to behaviour change or diet techniques where there's a goal as well. So any type of environment where there's some sort of a goal doesn't necessarily have to be an achievement goal or a performance goal, but to improve your well-being, for example, to decrease your disease symptoms, the same principles of motivation should hold.
Okay. I think that brings us nicely to the close. And the question I have for you is if you had some recommendations or advice for people listening around supporting themselves or their colleagues to reach that true potential, what would your suggestion be for them?
It's the reason my profession exists in the first place, is to try to understand these things. And of course, they are complicated. I'm a firm believer in a rising tide raises all boats. When we're thinking about trying to reach people's true potential, that normally isn't done alone. It's normally done with others and through others and by supporting others. True potential, not just of the individual, but of the collective, I think is a really important consideration.
That's really powerful. And I'm going to ask you, is there any final message that you'd like to leave our listeners with today?
One of the things that strikes me a little bit, again, if I suppose I'm plugging my own profession a little bit here, is that we do know a lot about behaviour change and there are experts in behaviour change, but I'm not sure my profession is particularly good at getting the word out there. These types of podcasts hopefully show that there are people that we can draw on who have this expertise and that you don't have to figure it out all yourself. If you're in a completely different discipline, I couldn't treat a patient, but I can change behaviour. So I think it's about, again, drawing on the expertise from different disciplines so that we can create organisations that thrive, that people thrive in them, that reach their potential.
Thank you for that. And are there any resources that you'd recommend people look at?
Yeah, absolutely. So I mentioned that we had a self-regulation intervention that we looked at for hybrid workers. Actually, all of the materials for that are available on the website of the Federal Institute for Occupational Safety and Health in Germany, which is actually who we collaborated with, both in English and in German. So you don't have to use Google Translate. They're there in English. The World Health Organization actually have really comprehensive guidelines. Now, they call it specifically mental health in the workplace and interventions around that, but it creates a very good process and template for if people want to look at how to change behaviours, how to improve mental health in the workplace, that are very useful. And the third resource actually goes back to some of the Horizon Europe funded research. So there was a really excellent project that finished just a couple of years ago, which was called H-Work. And amongst others, it developed multi-level interventions for how to target mental health in the workplace, how to improve mental health, looking at both from the individual perspective through to teams and through to organisation or managerial level as well.
That's wonderful. Deirdre, thank you so much for your time today. We really appreciate it. It's been an absolute pleasure.
You're welcome. An absolute pleasure, Juanita. Thanks a million.
So, as we come to the end of this episode of Walk and Talk Improvement, we would like to thank Deirdre for sharing her wisdom and experience so willingly. It's been such a privilege to speak with her on this topic. For you as our listener, we hope Deirdre's insights will continue to inspire you in your work to improve health and social care services. We hope you enjoyed this episode, and if you would like to hear more content like this, you can listen to Walk and Talk Improvement wherever you get your podcasts. Thank you for listening.